In 1980, only 2.5% of the US population were diagnosed with diabetes. Fast forward to 2021, and that rate shot up to just under 9%. People haven't changed, systems have. In this video, I'm going to discuss different strategies that communities can use to help prevent diabetes. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. To properly address diabetes prevention, we have to stop pointing the finger at individuals and look at our systems. Whenever we first started looking at smoking cigarettes as being more of a societal problem rather than an individual issue, that's when we really started to make headway in reducing smoking prevalence. The National Clinical Care Commission presented a report to the U.S. Congress back in 2022 that outlined their recommendations for what the federal government can do to help prevent diabetes. Now, even though these recommendations, they were targeted at the federal level, a lot of them can be implemented at local government levels too. There were 3 separate sets of recommendations. The first set of recommendations was targeted more at the general public in efforts to help prevent diabetes from ever occurring in the first place. Second set of recommendations, these were targeted more at those that were at risk for type 2 diabetes, like people with prediabetes, to help prevent the development of diabetes in these individuals. And the third set of recommendations were people that already had type 2 diabetes to help prevent the condition from progressing further and possibly even reverse it. For the general public, they were basically recommending what's called a systems approach. And so the recommendation is that agencies that aren't directly involved with health, like we're talking about transportation, those that deal with the environment, food, housing, commerce, agriculture, these agencies would work with health agencies to help develop policies that support diabetes prevention efforts. One way that this can be accomplished is through school-based programs that address the entire school body. Taking an approach that addresses child health behaviors is arguably one of the most important strategies for preventing diabetes from ever occurring in the first place, because health behaviors and diabetes risk factors like obesity, these tend to track from childhood into adulthood. And the damage that some of these diabetes risk factors contribute to in terms of damaging the cardiovascular system, it starts in childhood. My PhD dissertation focused on evaluating the effectiveness of a school-based child obesity program that was developed by the Scottish National Health Service and implemented in primary schools or elementary schools across Scotland. This was a 10-week healthy lifestyle program that was delivered by healthy lifestyle coaches. It included 45 minutes a week of health education and then another 45 minutes of supervised physical activity. There were behavior change strategies that were implemented, parental involvement was included too, and at the end of the 10 weeks, there were improvements in body mass index or BMI, and also improvements in LDL and HDL cholesterol. Down in the description, I've got links to 3 published studies from this research. Now, for these types of programs to work long term, they need to be delivered on an ongoing basis and not just a single semester. Other strategies that can be used in terms of school-based strategies could be providing healthier food options for children, also improving the surrounding neighborhood so that it's safer for students to walk or bike to school, and then mandating daily physical activity. The physical activity guidelines for children and adolescents is a minimum of 60 minutes a day of moderate to vigorous physical activity. At the end of the day, schools are responsible for the health and the safety of our youth. And it's important that if students or children are being required to spend the majority of their day at school, then they should be provided with opportunities to make healthy decisions. Another area of improvement in communities that affects all age groups is having an environment that promotes physical activity. So if you think about where you live and how your neighborhood's built, does it feel safe if you were to try to exercise outside? Is there enough lighting? Are there sidewalks? Are there places that you go on a daily basis that's within walking distance? Do you have a fitness facility or a gym nearby that's within maybe a 3-mile walk or a 3-mile drive from your home? My research team, we recently published the first questionnaire that measures how the environment, and specifically fitness facilities in your neighborhood, having home strength training equipment, and social support for strength training all influence or impact whether or not people decide to engage in strength training. And what we found was that people who had more access to fitness facilities in their neighborhood, so once again within a 3-mile radius, those who had home exercise equipment or strength training equipment, and they had people in their lives that supported them in participating in strength training, these people were more likely to meet the muscle strengthening guidelines for Americans. Local governments can help by improving safety features in their neighborhoods and also investing in fitness facilities that have strength training equipment. I've been really excited to see the number of fitness parks or calisthenics parks that have been developed in the Detroit area. People are more likely to be active if they see other people being active. I've got a link to the study that we did down in the description. Shifting gears now to a different group of people, so those that are at risk for developing type 2 diabetes. And so this can include people with conditions like prediabetes, insulin resistance, metabolic syndrome, and obesity. And so the recommendations, they focused mainly on increasing awareness in this population as to how these conditions can lead to type 2 diabetes, and also increasing awareness of healthy lifestyle programs and resources that people already have access to through their health insurance or other programs. Now, this can be done by enhancing already existing policies and programs. One program that a lot of people are eligible for that they might not be aware of, it's called the Diabetes Prevention Program. So check with your health insurance to see if you qualify for this program, because it's appropriate for people with prediabetes or those that already have type 2 diabetes. Their year-long program involves working with a healthy lifestyle coach. There's an educational component to it and also a social support group. They also have a 6-month program that's covered by Medicare, and I've got links to both of these programs down in the description. Now, if you live in more of a remote area, like where my parents live, there may not be in-person diabetes prevention programs available to you, but they do have a virtual option, so you can still participate, but it would be online. For those that already have diabetes, the recommendations focused on removing obstacles to treatments that have already been proven to work, also increasing the number of people that are working in diabetes prevention and treatment, and improving their education, and then also decreasing the cost for diabetes-related medications like insulin and other treatment options, and just making it more accessible and more affordable to receive treatment. Exercise, especially strength training, is one of the most effective ways to manage diabetes. There was a research study that was published about a decade ago that found that over half of the physicians in the US received no formal training in physical activity while they were in med school. Now, I hope that things have improved since then, but it's concerning that those that are on the front lines of diabetes prevention and treatment, they may not have some of the most important tools in their tool belt. Reversing the diabetes epidemic, it's not going to happen on its own. It's going to take building communities and strengthening policies that makes healthy decisions both easy and enjoyable. Thank you for watching.